More than 25% of people over 65 in the United States experience a fall every year, and half of them result in serious injury or loss of mobility. What's truly alarming is that many people don't realize the dull aches or tingling in their legs might be early signs of nerve pain, not just getting older. So how can you tell the difference between leg pain versus nerve pain after 60? And if you've been confused, what can you do to avoid serious consequences? In this video, I'll help you clearly recognize the difference between muscle pain and nerve pain. Watch all the way through because I'll reveal the critical mistake over 80% of older adults make every day when trying to treat their pain the wrong way. If you believe this topic about leg pain after 60 is truly important, leave a comment with the number 1 so I know to continue making more helpful content just for you. Part 1. The pain you think is normal could lead to your last fall. After 60, leg discomfort can come from many causes, but one of the most common is muscle pain. This is often confused with nerve pain in legs because the symptoms can seem similar. But knowing the difference tells you when to rest and when to see a doctor. Muscle pain tends to feel like a dull, localized ache that shows up after exertion, such as long walks, climbing stairs, or standing for hours. When you rest, the pain usually fades. You might feel tight calves or soreness in the thighs. This type of pain doesn't radiate along nerve pathways. But if pain appears even while resting, especially if there's burning pain, elderly, leg numbness, or pinprick sensations, there's a high chance it's nerve-related. Many people mistake muscle pain versus nerve pain, which leads to the wrong treatment approach. A 67-year-old woman in California regularly experienced aching versus tingling in her calves after grocery shopping. She thought it was overexertion, so she rested and used warm compresses. But after a few weeks, the pain spread to her feet. Doctors later diagnosed her with early-stage sciatic pain in seniors. If you're unsure whether it's regular muscle soreness or early leg pain versus nerve pain after 60, I recommend watching the playlist, Leg Pain After 60 Natural Relief and AMP. Tips? After this video, explore that playlist for simple daily strategies to improve circulation, reduce pain, and maintain strong, steady legs. The link is in the video description. Feel free to watch it once you finish here. What matters most is knowing how to tell nerve pain, so you don't treat every kind of pain the same way. If you misjudge it, you might mismanage it, and that can lead to losing control over your legs. Ask yourself, is this just muscle fatigue, or is it a warning sign of leg pain versus nerve pain after 60? If you're certain it's muscle pain, not accompanied by leg numbness or burning pain elderly, you can manage it naturally at home. Start with proper rest. Not complete immobility, but reducing strain on muscles and avoiding overstretching. That's one key to distinguishing muscle pain versus nerve pain, because muscle pain improves quickly with the right rest. Apply warm compresses for 15 to 20 minutes to improve blood flow and ease tension. A Mayo Clinic study shows that heat therapy can ease aching and tingling from tight muscles in seniors. Combine that with a gentle massage for noticeable relief within days. Simple stretches like heel raises, ankle rolls, or straight leg lifts while sitting also help. Especially for inactive seniors, these movements prevent stiffness and improve circulation, minimizing burning pain elderly linked to poor blood flow. Your diet matters too. Prioritize foods rich in protein, calcium, vitamin D, and omega-3s to help rebuild muscle, especially when you're experiencing leg pain versus nerve pain after 60 without a clear cause. Anti-inflammatory foods may also ease burning pain elderly from long-term muscle tension. If needed, supplements can help, but consult your doctor first, especially if you have chronic conditions. But what if the pain isn't coming from your muscles, but from something you can't see? The next part will show you why millions lose mobility because they didn't know this in time. Part 2, you may not notice it, but your nerves are quietly crying out. Unlike muscle pain, nerve pain in the legs often creeps in silently, but leads to serious consequences if unnoticed. Many people over 60 assume all leg pain is from tired muscles, overuse, or simply aging. That mindset puts millions at risk for numbness, weakness, or even loss of walking ability without knowing why. One common mistake is self-diagnosing pain as muscle strain, then using patches, massages, or walking more to get the blood flowing. But muscle pain versus nerve pain are completely different, and the treatments are too. Moving incorrectly with nerve pain in legs can actually worsen nerve irritation and cause widespread inflammation. A classic symptom is leg numbness, a cotton-like sensation under the feet or feeling disconnected while walking. Some feel burning pain elderly, especially at night or after sitting too long. If you feel an electric-like pulse from your lower back down your legs, it could be sciatic pain in seniors, the most common nerve issue in older adults. Many have misjudged leg pain versus nerve pain after 60 for months. They rely on daily over-the-counter painkillers, unaware they're numbing the symptoms, not solving the cause. Meanwhile, nerves stay compressed, circulation worsens, and over time, legs weaken, balance is lost, and damage becomes irreversible. Research from the National Institute on Aging shows nearly 30% of seniors with nerve pain in their legs are misdiagnosed early on, either due to unclear symptom descriptions or ignoring early signs. So, what is the accurate way to tell nerve pain? Listen to your body. Does the pain travel along nerve pathways? Do you feel aching versus tingling in wide, inconsistent areas? Does it persist even while resting? A 72-year-old man in Florida walked every morning. He felt mild thigh tingling and assumed it was exercise soreness. He continued walking daily, hoping it would pass. But within weeks, he developed clear leg numbness, couldn't feel the floor tiles, and fell due to loss of sensation. He was diagnosed with sciatic pain in seniors from spinal degeneration and nerve compression, left untreated for months. Another mistake is trusting viral leg pain exercises without checking with a specialist. Some exercises help with muscle pain, but can worsen nerve pain in legs. Causes vary. Some stem from B12 deficiency, others from diabetic nerve damage or spinal stenosis, so treatments must be tailored. Remember, if you can still clearly feel the pain, you still have time to act. But if your legs feel weaker, unsteady, or no longer yours, that's a major warning. If you're torn between muscle pain versus nerve pain, lean toward nerve pain. It's more dangerous and demands faster action. If you've had burning pain elderly, aching versus tingling, or persistent leg numbness, don't delay seeing a neurologist or musculoskeletal specialist. Accurate early diagnosis can not only relieve pain, it can preserve your legs, your independence, and your quality of life. If you enjoyed this video, comment number 9 below. And feel free to share where you're from and what symptoms you're facing. I'll be sharing some simple but powerful tips just for you at the end of the video. If you're truly ready to protect your legs, reduce nerve pain, and take back control of every step, then the leg pain after 60 natural relief and AMP tips playlist is where to begin. You deserve to move freely, live confidently, and never be limited by leg pain again.